Alcoholism is a progressive disease because over time it always gets worse, never better. Most alcoholics start out as social drinkers, and they have a period of time early in their drinking where they just have a good time and they have fun and nothing bad happens and it's enjoyable. But over time it changes, and gradually they lose control, the tolerance goes up, consequences start to happen, and they go from being a cucumber to being a pickle. And always in the back of their mind, they want to go back to being a cucumber, and it almost never happens. Sometimes when something tragic happens in our lives, we have so much emotional pain that we do try to numb it and anesthetize ourselves with alcohol after that. And that can really lead to an increase in drinking as well. Because if you don't know how to manage your feelings without a substance and you have something horrible happen to you, that's going to be the thing you turn to. As a psychotherapist, I can tell you that the idea that alcoholism is something that can be controlled at will is absolutely unrealistic. A lot of people who don't understand anything about the disease think that you should be able to control it at will, that you should be able to just say no, and that if you really wanted to stop, you could. But the truth is that you can't. And it's the thinking and the judgment and the loss of control that characterizes the disease. And although the alcoholic wants to stop, that's the one thing they can't do on their own without help. But with help they can. Recovery treatment is absolutely essential because alcoholism is a disease of isolation. It's isolation that fuels the disease and causes it to progress, and it's also isolation that is the product of this disease, where people end up alone. Through treatment, whether it's in self-help programs, individual therapy, intensive outpatient treatment, or inpatient treatment, there is connection with other human beings. And that is what reduces the shame and the stigma of the disease. And then people can accept themselves because other people accept them, and then they can get better. The disease does not go away. It's a chronic disease like diabetes, meaning it's a disease that needs ongoing treatment on an ongoing basis. It's not just a physiological predisposition and metabolizing alcohol differently. It's primarily a disease of the thinking and the spirit, and that needs an ongoing renewal. Almost every day we need to be renewed in our minds and spirits in order to stay on track. I find that with my patients, it helps them a lot to know that I'm also in recovery and that I've been sober for over 20 years because they do trust me more, and they feel that I know what I'm talking about because I've been there. And that's why I wrote my book, because I wanted to write something that would help people, that was unique and different, that I thought only I could write. And while a lot of psychologists and therapists write books, most of them write about other people. But I wrote a self-help book that I thought would help people, that was based on my own experience, not only in alcoholism and addiction, but even more so in sobriety, because creating a meaningful life in recovery is really what it's all about, and that's what we need help with. In sobriety, it's important to be patient and to keep taking steps and to keep moving forward, because this progress happens over a period of years, not necessarily over a period of months or days. But if we persevere and we do what we're guided to do, we get to our purpose.